So with regards to the question on amphetamine toxicity, so basically we don't routinely give amphetamines, we don't give sodium bicarbonate routinely in amphetamine toxicity, but there are two situations whereby we will give sodium bicarbonate. So first is when we see amphetamine-induced cardiotoxicity. So in amphetamine-induced cardiotoxicity, you see a sodium channel blockade. So when these high doses of certain amphetamines, when they block the fast sodium channels, so you will see on the ECG widened QRS complex. You might see ventricular arrhythmias. So sodium bicarbonate will help by increasing the sodium concentration outside the cell. Okay, so that will overcome, hopefully, the sodium channel blockade. And then it also help alkalinize the blood. So, and this will lead to reduction in the drug that binds to the sodium channels. And then there is this urinary alkalinization, which nowadays is not in thing. So previously, yes, we give sodium bicarbonate to alkalinize the urine because amphetamines are weak bases. So when you increase the urine pH, so that will reduce the reabsorption in the renal tubules and hopefully will lead to increased excretion in the urine. Okay. However, there are problems with this because of the risk with fluid overload, and also this might cause electrolyte imbalances. So that's why it's not routinely recommended anymore for amphetamine toxicity treatment. And then we have correction of metabolic acidosis. So this is another scenario whereby we might consider giving sodium bicarbonate. So in severe amphetamine toxicity, you might have hypothermia, seizures. Okay, so we have this fitting. So this will all cause lactic acidosis potentially. So the sodium bicarbonate may be employed to rectify, to correct the acidosis in critical care settings. So again, to summarize, when we have an amphetamine toxicity case, so we check, does the patient have severe metabolic acidosis? If yes, then we might give sodium bicarbonate and monitor the patient carefully. If there is no severe metabolic acidosis, then we look for signs of cardiac toxicity. If there are signs of cardiac toxicity, like there is a appearance of arrhythmias like ventricular tachycardia, wide QRS complex on the ECG, then yes, we might consider giving sodium bicarbonate to increase the sodium levels and alkalinize the serum. Okay, if not, then we only give supportive care. So we do not routinely give bicarbonate for elimination. Okay, so in summary, sodium bicarbonate is not routinely given in cases of amphetamine toxicity.